Hello, I'm Dr. Pelly, and I'm here to provide you with information about our Expert Skills program. Dr. Kim Peck and I are co-directors for this program that we created in 2012. The ESP is a free, evidence-based, online guided program designed to improve test performance by improving learning. It is developed from over 30 years of experience with medical students and is now offered as a contribution to improve medical education worldwide. The reason you should consider the ESP is that we adhere to research findings that show that you're more likely to use your time wisely and to perform well academically when you are mindful about how your brain learns. But we don't just stop with the theory and let you figure it out. Instead, we show you how to customize your learning to suit your own individual needs. We will begin with an example of how your brain learns to help you see a practical application. Then, with this example in mind, we will explain more about the program and how it operates and how you can make best use of it. Take a moment to reflect on how you do your best thinking. When you're learning something new, such as from a video, do you think better by talking first in order to think more clearly? Or do you prefer to think quietly at first so that you can decide what you want to say? Those who prefer to talk first often change their mind as they speak so that you actually hear their thinking process. By comparison, those who prefer to think first do this process silently so that they're more comfortable when they speak. The way you answer is determined by the gain setting in your thalamus. This gain setting is a volume setting and it doesn't vary over time. The next slide illustrates the location of the thalamus, which lies between the top of the spinal cord and the brain. Your learning is determined in large part by how much information gets to your brain. But this isn't a linear relationship. It can be too little information or too much information that gets to your brain. All of the sensory input that your brain needs to think with has to pass through the thalamus. This includes what you see, hear, touch, and smell. This input then must pass through in the optimal amount to the thinking part of the brain called the cerebral cortex in order for you to do your best thinking and learning. But students divide out into two groups. One group has a lower gain setting that lets less information through. The other group has a high setting that permits a lot of information to get through. So let's look at how this affects both unconscious and conscious behavior. Here we see that the low-gain students behave in a way to increase the information getting through. They're trying to reach the optimum. They make direct eye contact, they talk louder and faster, and they're generally more active. In other words, they fit the description of an extrovert. The opposite is true for the high-gain students. There's so much input that it is hard for them to think, so they try to quiet it down a little. In other words, they fit the description of an introvert. But as you can see, more of this is involved than just behavior. The response to sedatives is also different, with the low-gain students requiring a lower dose of sedatives because there's less input to block for sedation. Thus, even the physiology that we don't see is consistent with the behavior that we do see. The function of your brain is affected by your thalamus, and this affects the way you prefer to study. Low-gain students will get more from study time that involves talking out loud, and high-gain students will need their alone time to learn well. But medical school will require both extroverted learning and introverted learning. So, the ESP provides suggestions for developing your skill with balancing both learning behaviors. For now, we've seen an example of how the brain learns. So let's get back to telling you more about our program, and we can start with our tagline, Mindful Learning. Mindful of what? First, the ESP teaches why you should be mindful of how you are thinking in addition to what you are learning. This will ensure that you learn how to think better during exams. Second, we also teach you to be mindful that efficiency can be misleading, and effectiveness is a better measure of using your time. Effectiveness relates to whether what you are doing is the right thing to be doing. For example, efficiency is reading a book at 5,000 words a minute, but effectiveness is knowing you only need to learn chapter 2. Third, you should be mindful that your learning style is not necessarily the best route to your learning if it is left unbalanced. An example would be a student with a memorizer learning style may not have learned how to think about what they have memorized. And that is a killer on step 1. The ESP shows the memorizers how to balance their learning to think with integrative learning. Fourth, it's important that you're mindful of the need for some sort of action in everything you expect to learn. Long-term learning consolidation in your brain is a product of action and does not occur with passive learning. Avoiding action through shortcuts and superficial reading actually wastes your time. At this point, we can explain what the ESP is and how it works. First, the ESP includes a programmed self-study activity with the goal to help you become a better performer by learning how to become a better learner. You will develop your skill in learning in the same way that superior athletes, musicians, and physicians develop their skill, and that is through deliberate practice. We'll define deliberate practice more clearly later, but for now we will call it mindful practice. Second, the ESP teaches you about yourself. It helps you transform yourself from a passive receiver of information into an active producer of understanding. To be sure, it is not uncommon for pre-medical students to use a receiver strategy of learning to compete and gain admission to medical school. This means that you would be skilled at receiving information from your professors and mastering that information for your exams. And for all you can tell, during your pre-medical education, this appears normal and sufficient. But it isn't sufficient for success in medical school. The ability to answer complex case vignette questions requires that you become a producer of your own understanding, and just remembering isn't understanding. But don't worry, this won't be asking you to produce something out of nothing. The ESP will teach you how to study course materials in a way that makes being a producer automatic. This is explained with training examples that will help you produce the understanding you need to take permanent charge of your own learning. You don't become independent of your teachers, but rather you become interdependent with them. Third, it's also important that you know our program is evidence-based. That is, it is supported by research in several related fields of study on how people learn. This is not a test prep program or another version of other test prep programs. It's also not a guess or someone's favorite project. It is simply an application of what has been shown to lead to more powerful learning. In fact, the ESP would help you get the most out of a for-profit test prep program, just like it will with the medical curriculum. Aside from these basic descriptions, a few more details remain. The ESP has open online access with no required fee because it is the result of the work of many academic scholars, and we believe that should be shared with the world. We provide all required materials online through a special link so that other institutions can make use of this resource. And although there is no monetary charge, you will still need to spend time to develop your skills. You might wonder who can benefit from our program. Originally, the ESP was developed with volunteer medical students to be applied during medical school, but it has been successfully used by pre-medical students and resident physicians. And then there's the question, why is the ESP voluntary? Its self-development and self-actualization nature can be observed in the way it brings about a personal change in you. There's no way to grade it reliably from student to student as you would a college course. And also there's no point in grading it because everyone acquires skills in their own unique way. We can now take a look at the ESP as an orchestrated set of activities that train expert learners. Our program is divided into 3 main ESP blocks. The pre-matriculation block is ideally completed prior to arrival at medical school. This block uses the online Success Types book, a video series, and a companion study guide that shows you what you should be learning. If you're coming to Texas Tech, we send you an email invitation to participate in the program shortly after you confirm our offer of admission. Our intent is to help you apply the ESP principles during the remainder of your pre-medical studies. The orientation block continues the training with workshops on active learning that can also serve as a catch-up activity if you were admitted to medical school over the summer. The ESP Step 1 Prep block involves self-directed, small group meetings conducted through the first 2 years. Don't worry if you're not comfortable with groups. It won't be a problem. Our current students will tell you that the atmosphere is relaxed and no pressure to perform. In fact, everyone's encouraged to have reference materials open and just sit and listen till you're ready. The process is so engaging that it actually motivates the introverts to dive in. Remember, there are no faculty present and no grades involved. These question analysis sessions are conducted weekly using a special brain-based method to analyze practice test questions concerning topics that are currently being taught in your courses. So, another way of looking at it is that these sessions are not just Step 1 prep sessions, but course exam prep sessions. And the feedback we get from our students is that they feel better prepared for their exams. Now, before we finish, I'd like to introduce you to some of the major concepts that are taught in our program. The ESP Concepts begin with the growth mindset research. These studies have shown, as previously mentioned, that your academic achievement will be improved by learning more about how you learn. This is the first concept taught because it's the most motivating for students. We next introduce the concept of deliberate practice, which was discovered from human performance research. The use of deliberate practice helps you develop expert skill in your learning by correcting deficiencies that our program helps you discover. The ESP then introduces concepts from research on the neurobiology of learning. This research has shown that learning involves the concerted action of several skill areas in the cortex of the brain. The importance of this is that it provides us with a way to focus skill development on each of these areas. Both clinical problem solving and conceptual learning require development in the same cortical skill areas of your brain. So, while you're improving your learning in the classroom, you are also becoming more prepared for learning in the clinic. This skill development concept is the basis for naming our Expert Skills program. We then focus on learning style to show how unconscious preferences will predispose you to emphasize either the memorization cortical area or the integration cortical area in your learning. You will be taught that while both types of learning are needed, you will have to guard against neglecting your non-preferred style. The next slide shows several more concepts covered by our program. We teach how each step in the experiential learning cycle helps to identify the cortical areas that need to be developed for strong performance on exams and eventually in the clinic. The cycle begins with concrete experience, like a lecture, and ends with action, like paraphrasing your notes. This requirement for action forms the basis for what is called active learning. Then our concepts taken from sleep research teach how the brain changes itself through memory consolidation during sleep. Unconscious replay of prior active learning experience leads to either consolidation or pruning, depending on whether your study involved action. Pruning, which prevents memory from forming, occurs when activity was absent. Our first of two main learning strategies is the active learning system of concept mapping because it utilizes at least 6 different active study methods in a time-efficient manner to maximize both memory and understanding. Teaching this method to medical students was a breakthrough for me because it helped me to teach memorizers to improve their learning and their test performance by active searching for the way concepts can be grouped together in a concept map, something that had been previously absent from their reading. This active searching method will help you to develop your ability to discover critical relationships that you had not ordinarily learned for an exam. Our second main learning strategy is question analysis in small groups. As I mentioned earlier, this method forms the basis of the ESP Step 1 Prep block, which is designed to provide you with an efficient and effective way to simultaneously study for course exams while achieving long-term learning for Step 1. You will learn that you will not only develop thinking skills during the small group sessions, but you will also study more effectively when you're alone. Now, let's recap what this video has covered. First, we have described the ESP as an evidence-based, self-directed program that was developed from over 30 years of successful experience with medical students. Then, we've shown that the self-awareness concepts that are taught by the ESP help students test better by learning better. And before ending, here's a final thought. You might be skeptical of a program that doesn't cost anything but claims to help you become a better learner. You may feel you already know how to learn well enough and all you have to do is work harder. You may also have noticed that there are no promises or guarantees of an outcome if you do participate. All of that could lead to the simple question, what if I just don't bother with the ESP? The answer is that you can still get the job done, as many students already have. However, the research indicates that you will likely work harder to achieve the same level of performance that you want from your career. In that light, Dr. Peck and I invite you, wherever you attend medical school, to consider participating in our Expert Skills program in order to develop your thinking and your career. And thank you for your attention.